Hey everybody. So, in the world we live in today, we often find ourselves sorting out and negotiating and attempting to make sense of information we receive, especially when it relates to our health and healthcare. You may wonder if taking this medication, for instance, makes sense to you, or if you should agree to undergo this particular procedure or surgery your doctor is recommending. Here are 3 steps to take or consider when making healthcare decisions. Number 1, rely on the valuable amount of historical information that we have or research that has already been done on that particular disease or treatment. See, if that approach has been around for decades, all right, then the chances are it probably will be around for another decade, right? Number 2, know the risks and benefits of every treatment plan, especially the new ones that are coming out, Ozempic. Anyway, number 3, you need to know your own personal risks and benefits. Talking to your doctor will help you get that. See, these 3 steps are paramount before choosing, before selecting, or even deciding on what to do with your health and healthcare. So, how to make healthcare decisions, the Metformin edition. That's right. Let's talk about Metformin. See, number 1, Metformin is a diabetic medication that has been around since 1957 and has developed by a French physician at that. And he used an herbal medicine called Galiga officinalis. That's right, people. Metformin came from an herb, and a French doctor created it at that. But anyway, what's more important here is that it has been used for 6 decades. And that means there are 6 decades of information. Yep. 6 decades of information and data found on metformin to be safe and very effective in treating type 2 diabetes mellitus. If I were to bet, it might be around for decades to come. That is certainly experience on metformin's part. But also, the amount of knowledge we have about this medication, like when to use it, and most of all, who should use it. That is probably why it's still considered the first-line treatment for diabetes. And it is the most prescribed oral diabetic medication around the world. You see, that is a lot of history. Now, number 2, know the risks and benefits of metformin, right? The benefits are simple. Better blood sugar control. We know it works. So let's talk about the risks then, which is what we really need to know. It can cause abdominal cramping. It can cause nausea and diarrhea, vitamin B12 deficiency. It can cause headaches, dizziness, and flatulence. That is right. You'll be farting all over the place. But these side effects are rare and are seen in about, let's say, 1 to 10% of people. One serious side effect, though, that's worth mentioning is this thing they call lactic acidosis, which is so unlikely that the frequency is not even defined in the literature, which means that it happens in less than 1% of people. In fact, it is listed as a warning for physicians instead of just a side effect, right? It's a warning as opposed to listed as a side effect of the medication itself. That basically means that people with kidney problems who take metformin are at small percentage risk of getting this condition called lactic acidosis. Let that sink in a bit. Lastly, the 3rd thing, know your personal risk and benefits with metformin. It starts with your trusted physician to assess that risk with you. Assess that risk for side effects are extremely low and when compared to your benefits. You would have the best chance by doing that. The benefits surely outweigh the risk, and I know I don't need to tell you that. It will control your blood sugar. Yep, the benefits of having controlled blood sugars cannot be overstated, all right? This can prevent, at a minimum, right, decrease your risk for heart attacks and, other heart problems, kidney problems, and even blindness. So as obvious as the benefits are to you, then your decision should be that obvious as well. So you deciding on whether you should take metformin or, that your doctor recommended, then I hope you now have some history and background information about metformin. And I hope you understand the true risks and benefits of this drug. But most of all, you know how to obtain information about your personal risks and benefits with metformin. So discovered a strategy to making a choice after listening to this video is what I'm hoping that you can achieve. But remember that your ultimate strategy is one that you can co-create with your provider or physician. My name is Dr. Coupet, and I am the people's doctor. Thanks for listening.